Hi everyone, now we can discuss MCQ from Norcet, previous Norcet June 2023 key paper. So let us see the first question. Coconut oil. Coconut oil is harmful for coronary artery disease. Then second question. So when we are doing cardiovascular assessment for congestive heart failure client, we need to keep upright position. When we are doing cardiovascular assessment for congestive heart failure, so upright position we must keep. Then third question, child with iron poisoning taking drug IV defroxamine and during administration the child suffers from hypotension, facial flushing, urticaria. So at that time what we need to do? Immediately stop the medication. Then next question, patient with suspected femur neck fracture, client with suspected femur neck fracture. So as a nurse, while doing assessment to this client, which position we need to give? The answer is external rotation less than 45 degrees. Then next question. Here the client develops type 2 respiratory failure. The possible cause of this type 2 respiratory failure is failed chest. The failed chest is nothing but segment of rib cage break due to trauma. Segment of rib cage break due to trauma called failed chest. And here also you can see type 1, type 2 respiratory failure. If respiratory system can't provided by sufficient oxygen, so that we call type 1 respiratory failure. So type 2 respiratory failure means if respiratory system can't remove carbon dioxide, called type 2 respiratory failure. The next question. So when assessing the blood sugar level with the glucometer, so what we need to do? Wipe the first drop, leave or wipe the first drop of blood and use the second drop of blood for reading. Then next question, characteristic features of polyuria. Characteristic features of polyuria: diabetes mellitus, diabetes insipidus, glomerulonephritis. These three are characteristic features of polyuria. Chronic renal failure is not a characteristic feature of polyuria. Remember, chronic renal failure is not a characteristic feature of polyuria. Then next question, how much energy in kilocalories? Okay, how much energy we get from the, or patient get from the 500 ml of 5% dextrose. 500 ml of 5% dextrose. The answer is 100 kilocalories. Or you do the division, then you will get the answer. The next one, osmolarity of plasma for normal adult. Osmolarity of plasma for normal adults, 280 to 290 milliosmoles per liter. The next question, last question, diagnostic test for enteric fever in second week. Diagnostic test for enteric fever in second week is Waddell test. The next question, dengue hemorrhagic fever. Dengue hemorrhagic fever. What are the symptoms we notify? Fever, thrombocytopenia, increased hematocrit. Thrombocytopenia means low platelet count. Hematocrit, increased hematocrit means increased RBC. Then here, the next, the patient with seizures, priority nursing intervention is, here the client with seizures, so priority nursing intervention is, first, keep the patient in lying position, then turn head to side, then close the cloths, mainly at neck or chest area and abdominal area, and check is there any need of suction. Then supervise supplemental oxygen or bag ventilation. The next question, management of hyperkalemia or high potassium levels, management of hyperkalemia, insulin with glucose. The next question, here the client with the serum potassium level is 6.5 milliequivalent per liter, and so what change, okay, what change we can see in the electrocardiogram. Here the client with serum potassium level 6.5 milliequivalent per liter, and the change we can see in ECG, tall peak T waves. Here the normal level is 3.5 to 5 milliequivalent per liter. So here above potassium level we can see here. So tall peak and T wave we can see in ECG. My dear students, once we recall all MCQs. Coronary artery disease. Coconut oil is harmful to cause the coronary artery disease. And while assessing cardiovascular system who has congestive heart failure, then so we need to give the position, upright position to the patient. Then here the child with iron poisoning and is in IV defroxamine. So during that administration, the child has hypotension, facial flushing, and urticaria. If child suffers from these side effects, immediately have to stop the medication. The next one, here the client with fracture of femur neck, then have to give the position external rotation below 45 degree. Then here patient developed type 2 respiratory failure. The possible cause is failed chest. Then when assessing blood sugar with glucometer, first we need to leave the first drop of blood, then take the second drop of blood for reading for accurate result. The next one, the characteristic features of polyuria, diabetic mellitus, diabetic insipidus, glomerulonephritis. Chronic renal failure is not a clinical characteristic feature of polyuria. Then how much energy the patient get by the 500 ml of 5% dextrose. 500 ml of 500 dextrose is 100 kilocalories. The next one, osmolarity of plasma for normal adult 280 to 290. Then diagnostic test for enteric fever in second week, Waddell test. Then here the patient with seizures, priority nursing action is first have to keep the lying position, turn head, lose the clots, suction if needed, supplement the oxygen. Then management of hyperkalemia, insulin with glucose. Then here the client with hyperkalemia, that is 6.5 milliequivalent per liter. Then the ECG reading is tall peak T waves we can see. Thank you all.